So, in the interest of time, let's get started. Hi, everybody. Sorry. My name is Dr. Kara Jefferson, and I am the DNP Program Director here at Frontier Nursing University. And I have with me Dr. Kristen Gianellis, who is one of our DNP course coordinators. So, I will do the first part of the presentation, and then I'll turn it over to Dr. Gianellis to complete this for me because I have an emergency situation. So here at Frontier, our mission is to provide accessible nurse midwifery and nurse practitioner education that integrates the principles of diversity, equity, and inclusion. We transform healthcare by preparing innovative, ethical, compassionate, and entrepreneurial leaders to work with all people with an emphasis on rural and underserved communities. This is our mission statement. And the reason that it's here is because there are a couple of keywords that I really want you to pay attention to. Number one, the principles of diversity, equity, and inclusion. Our DNP program is the most diverse program at Frontier Nursing University, and we take pride in that. But also, we prepare innovative, ethical, compassionate, and entrepreneurial leaders. So when you leave our DNP program, not only do you come in with a whole skill set, when you leave, you have elevated where you were in all of those categories. And we're really proud of that. And our graduates can attest to that, as well as our current students. So in this open office or live Q&A session today, we're going to cover, well, why should you come to Frontier to get your DNP? And why should you get a DNP in the first place? We'll go over the programs of study, the admissions criteria to enter our DNP program. We'll talk a little bit about the DNP project, how to get started, and what we do with our DNP advising sessions where I assign you to meet one-on-one with a DNP faculty member to discuss your actual project. So here at Frontier, for those of you who don't know, Frontier is a distance education program, which means you don't have to leave the comfort of your own home, your community, wherever you are in this world. That is actually where we want you to influence and do your project because those are your people. But even more than that, not just for the project part, you can study from your living room, your kitchen, your mom's house, your dad's house, any family member's house that you want. You only travel to our campus in Versailles, Kentucky, one time for what we call a DNP bound experience, and that is our orientation. And we also have something here at Frontier called the culture of caring, where we embed that into everything we do. It's built upon the principles of mutual respect, professionalism, all of those things that you should come into Frontier with, but then you leave with a greater appreciation for. Here's a couple of pictures of our Versailles campus. The picture on the bottom right is the sign that you would see coming onto campus. And then as you come onto campus, these are some of the buildings that you see. Starting top left, these are what we consider where our students stay, the student housing. Next to that is a building that that is currently called the President's House, where there can be gatherings of people. The president does not live there. That's the question that we get asked the most often. And then the final picture on the right top is where students go and enter our campus once you come on. It's where we get you registered so that we orient you to the campus from that building. And then the most important building for our students has seemed to be the picture on the bottom middle, which is our dining hall, because when we're on campus, everybody likes to snack. But generally, when we think of mealtime, it's a time for people to connect with one another and share experiences. And Bound is no different when it comes to that. So a few things that we are proud of here at Frontier. We have over 80 years of experience in graduate nursing and midwifery education, which means We know what we're doing. We've done this for a really long time. We have systems built in place that we know exactly what we're doing. But even more than that, we have students and graduates that represent every state in the United States, but we're not just located in the United States. For the DNP, some of our DNP students actually choose to do projects where they work, which may be abroad because that's where they're living. And so we applaud that. But we have had over 9,000 graduates. And like I said, we know how to do online education quite well. We have also received the Insight into Diversity HEED Award, which is Higher Education Excellence in Diversity in 2023, but not just 2023. We've actually won that award 6 times. We have been recognized for 3 years, the past 3 years, as a great college to work for. We received AACN's 2023 award for Inclusive Excellence, Belonging, and Sustainability in Nursing Education. And we were named an academic honoree for this year, 2024's Healthy Work Environment Award, presented by Sigma Theta Tau's Honor Society of Nursing, so just known as Sigma these days. So what else do we have here at Frontier to offer you? Well, we have tons and tons of student support. And I think for me, the overwhelming message that I hear from students who have been in the program or are currently in the program is that they feel more than well supported, not just by faculty, but also by other students and other support staff. In our program, you will meet your financial aid advisors. You will meet our team of wonderful librarians who really keep us all where we need to be, because I don't know that any of us could do as well as we're doing in the DNP program without our librarians. We have a diversity, equity, and inclusion office that manages student support groups. So if you have an interest in something and we don't have a support group for it, you might be the person to start one. But some of our support groups include veterans in nursing or men in nursing, just to name a few. We also hold an annual diversity impact conference to celebrate the diversity and speak on diverse topics that are of interest to all of us. And we just make it a point that we know that when you're doing distance education, a lot of times you're alone or you're isolated because you're working by yourself at home. But what we have really done a good job of is making you, even though you're at home doing this by yourself, we have made it a point to make you part of a community that makes you feel like you truly do belong. So, as part of your support team, you have me, but you also have course coordinators like Dr. Gianellis. You also have the academic advisors who advise you on your plan of study. Like I mentioned already, the financial aid officers. We have credentialing coordinators in the DNP. We have a specific credentialing coordinator for the DNP who handles credentialing of all sites for our DNP project. And of course, we wouldn't be able to do anything without our wonderful IT support team, because the students love them, but sometimes some things happen. It might happen to your computer or something's not working well. Just know that we have people around who are here to help you with all of those things. So why should you get a DNP? A lot of times people will come and they'll ask and they'll say, well, I maybe should get a why should I get a DNP? Maybe I should get a PhD, or maybe I should get a doctorate in midwifery, or maybe I should get an educational doctorate. You could. You could do all of those things. And I'm not going to tell you that there's anything wrong with getting any of those things. But what I will tell you that when you look at what you could get from a doctorate in midwifery, for example, well, if you get a doctorate in midwifery, then it's saying the only thing that you're really good at or your specialty area is only midwifery, and you may not have that leadership component that you get here or that quality improvement component that you get from getting a DNP with us. If you want to get a PhD is more research based. So you ask research based questions and you have a control group and an experimental group. and you're digging into the literature a lot. You will dig into the literature with your DNP, so that encompasses that too. And as far as the educational doctorate, you want to get that. Why? Because you can teach. Well, guess what? You can also teach with your DNP. So for me, for anybody who truly enjoys clinical practice, but also wants to get a terminal degree, learn and grow leadership skills, quality improvement, know about health policy and how to lead teams, the DNP here at Frontier is what I would choose. Not just, and okay, yes, admittedly, I'm biased because we have a great team of faculty working in our DNP program, but our faculty don't just teach you these things. They actually embody it by living these things. So we're basing all of this on real world experience, which is what you would get from getting your DNP, as well as implementation science that is current and happening now, because we know that it takes an average of 17 years to implement new knowledge into clinical practice. We don't want you to wait another 17 years to get that done. We actually want you to do it now. I also generally get the question, well, is the DNP going to give me more money? I can't promise that wherever you're working that the DNP is going to necessarily increase your pay grade, but what you get from the degree is worth more than any money can buy. I could hook you guys up with some of our past graduates who will tell you how it's elevated them and their practice and their vision of healthcare in so many ways. So now that I've kind of told you why you should get a DNP, you're probably asking, what are some of our admissions criteria? So in order to be admitted into our DNP program, you must hold a Master of Science in Nursing, a Master of Nursing, or a Master of Science in a related field. You must have a current active registered nursing license with no encumbrances. You have to maintain national certification as a nurse practitioner or nurse midwife. You must also have a 3.0 grade point average, and you must pass a background check. So I think those criteria are pretty standard for any DNP programs, and I think they're also very reasonable. There's a caveat. So that was our postmaster's DNP programs. If you are a currently enrolled Frontier student in any of our programs, midwifery, women's health, psych, family, you can do what we call the direct admissions process. And so the criteria are the same. You have to have an active registered nursing license in the US, no encumbrances. Your process for admission is going to be a little bit different from the postmaster's process for admission, and you must apply while you are currently enrolled. You'll still have to do a narrative statement and a background check, but because we have your records, it's a little bit more streamlined right now. Our current postmaster's program of study is 30 credits, and the average is taking students about, well, the most popular program is 18 months, which is 6 terms. Each of our terms are 11 weeks where you are actively engaged in coursework, and then 2 weeks you have off between each term. So every year there are a total of 4 terms for all of the programs here at Frontier, and your actual DNP project would not begin until term 3 of those 4 terms. So we have the most common plan, which is our 18-month plan, but please know that whatever program of study you pick, it can definitely be, you can definitely slow it down. And the reason I say this is because on average, our DNP students are taking 21 months to complete their DNP. So it's more like 7 terms. Even there's quite a few who are also doing 8 terms. So just know that there is a little bit of flexibility of that once you actually get into the program. We have a total of 6 didactic DNP courses. Here they are. If you've attended Frontier in the past as one of our MSN students, you may have taken PC 713, which used to be called Principles of Independent Practice. You may have taken PC 702, which was Epidemiology and Biostatistics. And you may have taken PC 718, which is Evidence-Based Practice. We now have new prefixes and course numbers for all of our DNP courses. And so they are listed here for you to see. But if you are coming in as a postmaster student from another institution, these are all of the courses you would take. Every single one of our courses in our DNP program allows for immediate practical application of all concepts. So it's not, oh, in this term, I'm taking nurses educator and fundamentals of business and finance and advancing healthcare, and I can forget everything that I've learned there by the time I get to DNP 805, which is leadership and organizational dynamics. What happens is we have a scaffolding process where what you've learned in all of these courses helps you to understand where you will be once you get here, which is your DNP project courses, which are structured so they're at the end of your program. Our DNP project consists of 4 courses: project prep, planning, implementation, and dissemination. And you cannot take any of these courses simultaneously. So these courses occur over 1 year, and the prep course is generally taking with some of your didactic courses. But here are the course numbers. Because our project courses are built on real world practical experience, we expect that you will be on site to manage and lead your DNP project with your team. And so you must be on site at least 3 days a week for the planning and implementation of your project. And then for your dissemination of your project, you must just be able to present your project on site to those stakeholders about that project. So to recap, our DNP program has 6 practice-oriented didactic courses. Our DNP project has QI initiatives over 3 terms, with the prep course adding a 4th term to that, but it's necessary to get your project credentialed and make sure that we have all of the boxes checked before you begin your project. We have something called a DNP bound experience. I know that I mentioned it, but I didn't talk about it, so I'll actually use this opportunity to talk about it here. DNP Bound is what we consider your orientation process to Frontier. During Bound, you learn about us, who we are as people. You get to meet us. It's usually me and a couple of faculty, but you also get to meet staff. And these are staff that you will be coming into contact throughout your DNP program, just so that we can make you feel ready, connected, and inspired. It is a 2.5-day event on campus that you travel to, and the students really, really love it because it not only gives them a chance to connect with faculty and staff, but you also get to know the people who are going to be in your courses, people that you potentially will be doing group work with. And so we enjoy it. And then we enjoy the flip side when you come back to us at commencement and everybody gets to reunite all over again. So if this has been of any interest to you, please know that our upcoming application deadlines are June 26th for coursework beginning October 7th of this year, and September 25th for coursework that begins January 6th, 2025. Our application process is relatively streamlined. You will complete the online application, and as part of that application, you will need to upload an essay. You generally on time management, but it can also be it may also be on the DNP essentials. That piece of it is currently being revised, so just pay attention to whatever the prompts are online. I want to take a few minutes to discuss your resume or your CV, because sometimes what we see is people will apply to our program and your resume or your CV is actually not showing who you are and not representing your best self. And what I mean by that is you want to read this in advance. You want to make sure that you don't have any misspelled words. You want to put down all of the things that you've done. If you've given any poster presentations or podium presentations, or you've led a group of people or even precepted anybody, you want to make sure that all of those things are represented on your CV because it speaks to who you are as a person and allows us to know how we can help you become the DNP scholar that you want to become. So please, please, please take that seriously and don't leave anything off of that. You will also need a health professional reference. A lot of times people will go to the people who you think are going to give you the glowing reviews because after all, this is an application and it's competitive and you're going to be competing against other people. And I think that that's great. But honestly, the most important professional reference actually comes from your immediate supervisor because they know your work better than your friend who you're working with in a cubicle next to you or your other nurse practitioner buddy, right? So you really want to take into consideration the best person to submit that reference because it makes a difference when you're applying and competing against so many people. And then, of course, your transcripts. You want to have those ready to be able to send because we need a completed application in order to consider you. What happens is sometimes some students start submitting a portion of the application but never finish. It's best if you can get everything done in one seated session, just to make sure that you're not forgetting anything. We're also really proud that our program is one of the most affordable programs in the nation. It is currently $665 per credit hour. Our tuition may change, but that is what the current rates are. So just wanted to put that out there. So I touched on this a little bit earlier. How do I begin the DNP? There are two methods for entering. Direct admissions, if you're a currently enrolled MSN or PGC student, or the standard admission process for our postmaster's graduates. So these are people outside of Frontier Nursing University who are nurse practitioners or nurse midwives and may have come to Frontier in the past. And so it's completely dependent upon when you graduate and when you want to actually begin your DNP courses. I will stop screen sharing for now so that we can have Q&A. So please feel free to unmute and ask any questions you have.
Dr. Jefferson, there are some questions regarding direct entry, people who have previously graduated coming back versus people who want to finish and defer for a term. And, I started to answer some, but then realized that I don't have all of the answers to that. So perhaps you can illuminate some of those questions.
Okay. So if you are a currently enrolled FNU student, you have what we consider a degree audit. And at the bottom of your degree audit, so if you don't know what I'm talking about, please reach out to, if you're a currently enrolled student, reach out to your academic advisor. But on your degree audit, at the very bottom, there is something called transitioning into the DNP. That document has a lot of the information that you need to be able to help you make an informed decision about when you should be applying for that DNP program. So I think that's one part of the question that you asked, Dr. Gianellis. It was multi-part.
Yeah, there was also questions about if people wanted to defer, like, finish their master's and then have a gap before starting,
That is all in that
that's
document,
all in that
transitioning
document.
into the DNP.
And
Yes, if
then
you're a current student.
someone who has previously graduated from our program, from our MSN program and is coming back to complete that would be on a case by, that's a review of degree audit, correct?
Correct. So I actually just had a meeting about that today. And so if you came to Frontier already, got your MSN and then, or your PGC and decided to leave, and now you're returning for your DNP, we consider when you're coming back, we look at whether or not you've taken in the past PC 702, 718, and 713, because those courses used to be part of that curriculum and are no longer part of the MSN curriculum. They're in the DNP. So we look at these on a case-by-case basis. Now, with that being said, we have messaged for 2.5 years that we are only accepting that credit up to a certain point. So anybody who, so if you're worried and you're thinking about applying this year, you're fine. We're going to accept those courses that you took. But if you wait until 2020, the end of 2025, beginning of 2026 to apply, we will not be accepting that credit because our courses undergo revision. And so because we promised it, we're leaving that option open, but we can't leave that option open infinitely.
I have a question.
Yes.
I am currently in the midwifery program and looking to continue my DNP, and I did take those 3 classes. I have a scheduled graduation date for March. Would I still apply in September, or would I apply the next year in January?
So if you are due to complete in March, or it depends. So anything after this year, anything after this last application cycle will require, in 2025, there will no longer be a direct admissions process.
Okay, so it would be in my interest to apply in the fall,
Yes.
if at all possible. Okay.
Well, you would apply when you're taking your comps course.
Okay. So
Does
it
that
really
make
depends on
sense?
how quickly I can finish my clinical hours.
Correct. And it's not to rush you to,
Right.
hurry up and say, oh, hurry up, finish your clinical
I
hours. No,
think
we want you to be able to get all of those skills that you need.
if I were to apply and do the direct entry process, do those credits that I took still count?
Yes. So whether you do direct admissions or you do the postmasters, those credits will still count. So
Okay.
it's just the actual which application will be available at the time. One of them is going to go away, and then we're just going to have one, because right now our 2 different admissions processes are confusing the students. And so we're really trying to streamline that.
Okay. Thank you.
No problem. And is it Leah or Laya?
Yeah, it's Leah. Thank
Hi,
you so
Leah.
much. Leah has questions, but so one question is, I have a psych NP. I've applied for the postmasters at September. So with the September 25th deadline for the DNP, I heard somewhere that you can do it in 21 credits right now. Is that what you were talking about? Like 2 less?
If only
That
if
there's
you,
something being phased out.
yes. So our current companion program, so we have a lot of terminology that is confusing to a lot of people, and I
Yeah.
think this speaks to that. So what we did before is we had something called a companion program, where we had 3 DNP courses embedded into our MSN, so that our MSN students could just go directly into the DNP. So if you elected to continue once we made the announcement and continue to take those 3 courses, you would be considered a companion student when you come back, because we're going to count those 9 credit hours towards the 30. So all you would have left are 21 hours to complete your DNP. If you are a postmaster student and you've never attended Frontier for anything, you have the full 30 credit hours to do, unless unless you request transfer credit. Does that make sense?
Oh, so I've never been a Frontier student, and I will be starting for the postmaster's FNP in September, so there would be no way to get that 21 credit.
No. So if
No.
you're just starting as a PGC in one of Frontier's programs, those 3 DNP courses are no longer embedded in our MSN or PGC curriculum.
So for requesting a transfer, like I went to Rutgers for my last graduate, is it something that other universities likely that I've taken?
Only if they
Is
were
that what you're
doctoral
talking about?
level, only if they were doctoral level
Oh.
courses. So what happened was we
Okay,
took DNP courses and embedded them in our master's
got
program.
it, got
So
it.
the course level was at the doctoral level. Yeah.
Perfect. Totally understand. In the realm of saving time, though, would I be able to enroll, because if September 25th is the deadline, I think you said, for the DNP, can someone enroll in the DNP while they're in
In
the
a different program?
postmasters, or
So if you are a postgraduate certificate, currently Frontier's policies and procedures do not allow you to be concurrently enrolled in 2 different programs. You have to either be in your PGC program or in your DNP program. But right now we don't have concurrent enrollment.
so if I was hoping to do both, we're talking about at least 3 years
Correct.
from beginning to end?
Yes.
Okay.
As it stands right now. Yes. We're working on something that's for psych that's all in one, but we're not there yet.
But that would be for psych.
Mm-hmm.
Did you say? I already
Yes.
did psych. Okay.
Okay.
Thank you.
You're welcome.
I have a question.
Oh, okay.
How many credit hours are you allowed to transfer? I'm in a program already that I'm going to have withdrawn, and I'm wondering if I can transfer those credits. How many am I allowed to transfer? It's a doctoral program.
You are allowed to transfer a maximum of 9 credits into our DNP program, subject to review. So all of those requests go through the registrar, and you would have to look at the catalog to make sure that the courses that you want to transfer are indeed similar to ours in that way. But we have there's a couple of us who meet and we review all course transfers, but a maximum of 9 credit hours.
Thank you.
You're
And
welcome.
also, yes, one more. Also, for the bound experience, DNP bound experience on campus, if
Yes.
you're thinking of doing coursework beginning October 7th, when will the experience be?
It will be in, I want to say August.
Yeah.
Do you have a date?
Yes, I do.
Okay, thank you.
I believe those were put in the chat.
Yes.
I think where someone had,
I have the date,
put it
but it's
in
on my
there.
calendar. Okay,
It's
perfect.
August 21st through the 23rd.
Thank you.
You're
Thank
welcome.
you. Thank you.
Patricia?
Hello.
Hi.
I'm Patricia Estes. I'm currently in the Women's Health Master's Program. It's my second master's, but it's okay. It's Women's Health. My question is, and I wanted to clarify, you said in 2025, is the direct entry option going away? And it's just going to be a regular admission type process for you to apply?
Yes.
Okay. And is that what part of 25? Is that January 25?
That is a good question, and I would have to look that up. Can you email me?
Well, yes.
And I can get you the answer.
And my completion date is around summer of 25. And so just kind of wanting to line that out.
So actually, too, that is in that transition to DNP document. And I think I just pulled it up. And so All students entering the DNP in January 2025 or after will complete the standard admissions process.
Okay, so it's January. Okay,
It's January.
thank you very much. And
You're
I
welcome.
earlier a question about deferral. So, getting out of school, sitting for boards, being a provider, being in a new organization, all of that is obviously a large learning curve. So if you are accepted, how many terms may you defer?
You are able to defer 1 term. And I'm so glad you brought that up. I actually think that it's a good idea for any new provider to actually learn your role and learn the environment. It is very difficult to go into the DNP, especially if you're already in one of our programs and you want to go directly into the DNP with minimal interruption, unless you know the clinical site really well, the people really well, and the problems or potential gaps that site has. It's actually in your best interest to get familiar before you're now coming back to lead and manage a group of people. It's really hard to lead and manage a project if you don't really know all of the nuances of that site.
Right. And it's, I wanted to keep some good momentum of, being in school and then, doing the application process and deferring while I kind of get some of that under my belt. But
yes. And so there's also with the good news. So remember earlier, I said that the most common plan of study is our 18-month plan of study. Here's the thing, even while, let's say you decide to apply to the DNP because you said that you want to keep going, we actually don't need to jump you into the project course in the very first term. You can take 1 course at a time. You don't have to, especially as a companion student, you don't have to take multiple courses. We can slow down, or we pretty much can customize your plan of study to make sure that you finish within our degree completion timeline policy and still get it all done and become acclimated and oriented at your site.
All right. Thank you so much.
You're welcome.
We even had some students who decided, they needed an additional term and they've taken an academic hiatus as if it fit with their academic plan. And it was, within the parameters that are allowed, and just because they needed that additional time at the site. So, when Dr. Jefferson said the typical time is 18 months, but we're seeing students on average about 21 to 24. That's not because the program is too hard. That's just because life happens, and we are a program that really respects your life and respects that you have to do what's right for you. And so our students are encouraged to make decisions term by term based on what they need to do.
I also
Now,
saw that somebody asked in the chat about bound. And this is the other thing that I forgot to say. If by the time you apply for our DNP program, if it will have been less than 2 years from the last time that you actually attended Frontier. So like, let's say you're a current student and you want to apply for September, you will not come to unless you want to. If you want to, we are happy to meet you in person. But if you have come to Frontier within the last 2 years, you are eligible for our virtual 1-day bound session. You do not have to come on campus for our 2.5-day bound. So there is that distinction, but it all is predicated upon when you last attended Frontier as an active student.
Dr. Jefferson, there's also a question about vaccine requirements.
Oh, that's a great question. You can apply for a vaccination waiver if you need. They go through the enrollment coordinators, and then they will get with me, and I will ask questions, because whether or not we can accept your waiver depends on where you're doing your project site and whether or not those people would accept that organization would accept that waiver. But yes, we have had students waiver requests granted. There's another question. Nurse Zephyrin, I think. Nearest.
yes. Hi, how are you?
Hi.
So my question, I will be entering as first the psych MSM program, and you mentioned something about working on a combined program. If one is already enrolled, actively enrolled, would they qualify for that combined program?
I don't know. That's the best answer I can give because it's still a work in process. Anything else that I'd tell you would be me guessing. Honestly, we have work groups, but it is not it's not something that is done right now. So if you're about to start, it's probably not going to be done in the next 6 months is what I'm saying, or longer.
So I'm just entering for summer of 2024. So I won't be done till like 2026.
Well, we have a lot of steps to go through before we can post a program of study. So that's what I mean. So
okay.
It would just be you continue with that program and then go on. And if we make something open, we're always announcing stuff to the general FNU community. So if that were to happen, you would hear about it.
Okay. Okay. Thank you.
You're
There's
welcome.
also a question about number of clinical hours required. And I think we also have some questions about sites. So I don't know if you want to answer the clinical hours and I can talk a little bit about sites, or did you have other slides about that?
We have other slides about that. So we'll get to that in the second part. And then I think T. Macklin has been trying to unmute. I think they have a question. I've seen them.
Yes. Hi.
Hi.
Good morning or afternoon to everyone. I currently work as an FNP at a F2HC, and just to piggyback off what you were saying to get familiar with the site, I really would love to implement my project there. So is that acceptable?
Yes. Yes, and Dr. Gianellis will go over that in the next couple of slides. We actually want you to be able to do your project where you're working. It makes your life a heck of a lot easier. It makes our life easier as well for the most part. And so you're not doing. And so I think there's this general perception that people are getting their DNP and you're doing all of this coursework because I'm making you do the coursework, right? Or the faculty is making you do this coursework. Honestly, the whole purpose of somebody getting a DNP is so that you could impact your community. That goes back to our mission, whether you're in a rural health area or you're in an urban or suburban area. I want you to do the DNP where it's actually going to make the most sense and be relevant for you and your community.
I have one more question, then I'll keep quiet. I understand, if I understand what you said, we are going to be working on our project from the first day of our didactic. Am I right?
No. So what happens is you start learning concepts and skills that you will take and apply to the project. So for example, if we use the most common plan of study, which is the 18-month plan of study, you actually don't start working on your project until your third term. So you will be taking 2 didactic. So if we look at if we're looking at that plan of study, your first term would be 2 didactic courses. Your second term would be 2 didactic courses. And your third term would be 2 didactic courses plus 1 clinical prep course.
Okay. All right. Thank you so much.
You're welcome. Any other questions before we move on to the next part? And Dr. Gianellis, do you want me to screen share? Still?
Doesn't matter. Yeah, you can screen share if you can, because I don't have the slides pulled up right now.
Okay.
Unless you want to send them to me quick.
No, I got it. Let me start.
I do have one question before you move on to the next section.
Okay.
So do you all, as far as textbook wise, I know there are a lot of universities that are transitioning, still have the option of having an actual book in your hand. And I'm just asking because after working for 8 hours looking at a computer, the last thing I want to do is come home and look at a computer to read chapters.
Correct. So a lot of what we have is based on our faculty really try to be cognizant about different learning styles and learning needs. So for some courses, if there is an electronic copy of the book as well as a physical copy of the book, we give you the option. We don't say you must buy this electronic version, right? So everybody learns differently. I will also say that a lot of what we do in our programs is we make sure that in Canvas, which is our learning management system, that we're appealing to different people's learning styles. So we know that some people are auditory learners and some people are more, visual learners. So we make sure that there's a combination of videos as well as written material. So there are some students who like to print out all the content in the modules. And then there are some people who are like, oh, I have 10 minutes here. Let me listen to this video. They may not watch it, but you can still hit play and listen. And so it's up to you to figure out what way works best for you. But we try to be cognizant of that while also recognizing that books are a major expense for DNP students. And so we have tried to keep our book costs as low as possible to the point that once you start the DNP project, you're not really buying any new book that you haven't already bought for one of the didactic courses before at the moment. So we're really cognizant about not only finances, but learning styles and learning preferences.
Okay, thank you.
You're welcome. All right, Dr. Gianellis.
Okay, so I love to talk about the project because this is one of the areas that I work in. So I am the course coordinator for the implementation course, which is when you actually come into the program and you do your quality improvement project. I'm also course faculty for for students who are going from the planning phase all the way through to dissemination. And so I walk with students through this process from start to finish, as well as coordinating. We're doing quality improvement in this course, and so in this program. And so our quality improvement, just like Dr. Jefferson said, is focused on closing that gap between what is happening in the literature and what is happening in the actual clinical site. And so we know that currently it's 17 years. A study comes out and 17 years later, we're actually implementing it. We want to close that gap to much less time. And so what you are looking for a project topic is you're looking for an evidence-based practice gap, something that you are seeing in the clinical setting that is not happening the way that the literature says it should be happening. And it's not because people are not doing their job, it's just because we all know that practice is difficult and it's hard to do every single thing that the literature says to do. The topic needs to be driven by the site. So this is not your passion project. Sometimes your passion aligns with your with what the site needs, but a lot of times it ends up being a need that the site has. I think someone brought up that they were thinking about a FQHC. FQHCs get their funding from the government, and they have to meet certain quality metrics in order to maintain their funding. And so FQHCs often will say, we need improvement in this specific metric. Certainly there are other sites out there that are looking at those same metrics because they are looking at their reimbursement rates with insurers. So before you start a project, we always want you to meet with the service director, the QI committee, and really see what does the site need. Our projects are always population focused and focused on outcomes. So we don't do something that's just like, educating a group of nurses. While that is certainly important and it may become part of your project, we want to be focused on improving patient outcomes. So really moving the needle on our patients' outcome at the end of the day. And it has to happen in a clinical setting. We can't do projects in an educational setting at this point in time. It really needs to happen in a clinical setting, whether that's inpatient or outpatient. It could be in the community setting, meaning like, visiting nurses or something like that, but it needs to be in a clinical environment. We also focus this on one of the IOM's 6 domains of medicine, which we have right over here: safe, effective, patient-centered, efficient, timely, and equitable. And so we're really trying to infuse some theory in there, and we get our patient and team engaged in this process. You are never doing quality improvement by yourself. So this is not your DNP project. This is a DNP, this is a quality improvement project that you are leading for the site, for the patients, to improve their care. You're leading it together with the site to move things forward. And you're solving a daily problem. As Dr. Jefferson's putting in the chat, the number of hours is 500. And so that is spread out over time. Believe it or not, 500 hours comes really, really fast in our DNP program. And we don't have students who are struggling to meet those number of hours. It happens organically, and it happens quite naturally. We start with our pre-planning course, which is DNP 850. And during that course, you get individualized counseling with one of the DNP faculty members. And we talk with you about making sure that your site is an appropriate site. We talk and make sure that your topic is an appropriate topic. If there are any concerns about how the site might interact with that topic or what, we also work on that with you. We talk about work-life balance. And we do all of the paperwork that happens and needs to happen before you get into the clinical site. You're also going to do a lot of really dive into the literature during this course as well. So Henry Ford, if you had asked, he said, if you'd asked people what they wanted, they would have said faster horses. They wouldn't have said cars. So, this really makes me think when, quality improvement is about really thinking outside the box. And so that's the true work of your doctorate, is looking for other ways to improve care. If it was easy, it would have already been done. So things to consider as you plan ahead. Think about, do you have a potential clinical site? So if you are already working in a site, if you are an APRN, you are already working in a setting, you will want to talk to your setting and see, can I do a quality improvement project here? It's great if you can do your quality improvement project where you are working, because that simplifies your life. You're not driving all over the place. You're already in that electronic medical record. And really, there's a lot less, there's a little bit of crossover in your life as far as, leading the project because you're already there. We do have students who their sites say, no, you cannot, and they have to go and volunteer at another site. Volunteering at a site is challenging because that means unless you have the ability to stop working, you're usually balancing both a job and a volunteer site at the same time. Typically, what the hourly site requirement is, if you're volunteering or if you're working there, is about 24 hours on site during the planning and implementation course. It is definitely not, it's definitely not 24 hours exactly. It's not scheduled, but at the same time, to be 24 hours in one place and then have a 40-hour job in another place can be quite tricky. And again, we can always talk about this. We can talk about it before you get to pre-planning. It is okay. if you're starting a new job as an APRN, and I think Patricia had this, we discussed this a little bit with Patricia already. It may be that you want to take some time to transition, and so it's okay to go a little bit slower. If you have just recently graduated and you don't have your APRN job yet, and you want to take a little bit of time before you get into your APRN job, we also have students who will implement as a RN. We can still implement quality improvement as a registered nurse. QI can happen at all levels of the profession. And then I always want people to think about what else is happening in their lives. We really think about our students as whole people. So one of the parts of culture of caring that I really enjoy is that I get to know a little bit about my students. They get to know a little bit about me. And I really, truly do care about each one of my students. And so I never want to see a student who gets overwhelmed by school plus the rest of their life. And, you know, family and personal wellness have to come first. And so if you are growing your family, if you're caring for a loved one who's ill, if you're planning to move across the country, it may be time to take a little break, and we have to, you know, delay the project for a little bit, and that's okay. Maybe your work schedule is crazy for the next 6 months and we decide to defer, or maybe now is a great time to really dive in. And so those are all the discussions that we have with you, and really think and consider as we're going through. So, you know, we'll just end with this quote. I think this is the last slide. You know, the distance between who I am and who I want to be is separated only by my actions and my words. I know that my time, so I'm a graduate of this program, as are most of the faculty that work here. I know that my time in this program truly was transformative. It changed the way I think in a clinical setting. It changed my perspective on, you know, sort of healthcare as a whole. And it also provided me with leadership skills I didn't know I had, which was really exciting as well. So I hope that we can answer any questions you have. Oh, I guess there's another slide. There will be obstacles. And it's going to be hard work. And so I always say to students, you know, it's not a master's degree, it's a doctoral degree. It's going to feel different than your master's degree. You will have to work hard, but you will be well supported at Frontier. One of the great things is that you will walk through this program with a faculty member who is your mentor during the project. And you will have that support and a person that you can directly ask questions to. And a lot of people who have gotten their masters at other places say, gee, I did not have this level of connection at those other schools. So we work hard here, but we get it done. This is one of our graduates. All right, so questions about financial aid. Or admissions. These are the email addresses for it. And I guess now is the time for additional program questions. What questions do you have? Malik?
Hi, so I'm in the master's program. I graduate in June, so I believe I'll be able to start the program in fall, October, correct?
Yes, congratulations.
Thanks. So and I'm in the psych program. I know the amount of hours is 500. What you said it has to be all done on site, because you know with the psych, some of it's telehealth as well.
Well, so on site can mean virtually on site. It's in a doctoral program, it's working on your clinical project. And so we're not clocking in, clocking out. We are, it's the time that you spend in the clinical environment, which for you might be completely virtual, and that's okay.
Okay, and then if this other question you might have answered, but I apologize, I didn't hear it. I know the amount of hours is like 500 something. Is that going to increase in the future?
Dr. Jefferson, do you have an answer for that one? I know that that's a moving needle with
Do you mean the number of clinical hours that we require?
Yeah.
No, so altogether, your DNP plus your MSN clinical hours per our accreditors must total a bare minimum of 1,000. So that's why, so let's say if you took one of FNU's programs, you generally end up with probably over 600. We still do the 500 because then that makes sure that you are good from all fronts when it comes to the accreditation process and getting licensed.
Okay, perfect. Thank you. I appreciate it.
You're welcome.
And the hourly requirement, it's, you know, people get worried about it. It's really something that generally our students just doing their project, they get the hours.
And there is a required where we have to go to Kentucky, is it Kentucky, correct? Another clinical bound?
Depending on if you are a Frontier student already and you've been to Bound within the last 2 years, you may be eligible to not go to Bound unless you want to come. You may have to, we do have a virtual option for those who are just like, were at Bound recently in the MSN program, but most people will be coming to campus for that 3-day experience.
I went recently in January, and I think I actually enjoyed it. You get to meet a lot of the teachers, and you get to meet a lot of colleagues. So I think it was actually worth it.
Yes, thank you for rooting for Bound, because it is one of my favorite experiences for sure.
No, I didn't think it was gonna. You know, I didn't think about it well before I went, but it was 100% worth it. So thank you.
Thanks.
Thank you. Denise asks, will the extra hours from the MSN program cut down the amount of clinical hours for the DNP? It will not. Because a lot of people would like to sit and think that their DNP is an extension of their MSN program. They're completely different. And so what you did for your MSN was not about you being a project manager or leading teams. It was about you learning how to be an advanced practice clinician. In the DNP role, we're actually elevating you to become that leader. So those clinical hours do not count.
You're also not going to stop at 500. You are going to do the number of hours required to get the project done. And so it may be that your project, we just have to do at least 500. And so it may be that your project is just going to require 600. We don't know.
It's completely dependent upon you and how your ability to work. But we do not have preceptors in our DNP program. And I think that's important to mention because a lot of people are like, who's going to be my preceptor? We have what's called a site sponsor and a site mentor. And those people are here to help and guide you and be your thought partner for your DNP project. But the hours are not like, hey, Sally, you go in the room and assess and diagnose that. That's not how we count our clinical hours. So I think it's really difficult for us to sit here and try to quantify what that 500 hours looks like and try to convince you of that. It's more you're incorporating your DNP project into your already existent workflow. And when you're working on that and incorporating that, those become the clinical hours.
Very true.
Any other questions?
Kelly Jane has a ringing endorsement for the salad bar on campus. Thank you. And also, she says that there is 24 access to the cafeteria for snacks, coffee, and other beverages, which is nice as well. Thank you for touting that. I know.
So if y'all have any other questions, admissions has, Tamika put it somewhere. I think we got lost up there, but if you have any questions regarding admissions or the applications process, you can give them a call at the number there or FNU admissions at frontier.edu. If you have other questions specific to actual DNP programming, I'm your person, so please do not hesitate to email me. And thank you very much for giving us an hour and 7 minutes of your afternoon.